Today, we're diving into something that's, well, it's pretty wild. We're talking about a disease that can cause some really serious, irreversible damage, all while the person feels totally fine. It's called silent Crohn's disease, and its biggest threat is right there in the name. It's silence. Just think about this for a second. Imagine there's active, progressive inflammation going on inside your body, but on the outside, you feel great. This isn't some hypothetical. For a lot of people with Crohn's disease, this is a very dangerous reality. And this is really the core of it. On the one hand, you've got what we typically think of as Crohn's, those unmistakable symptoms that tell you something is very wrong. But with silent Crohn's, it's like the body's entire alarm system has just been switched off, even while the disease is on the attack. Okay, so what exactly is this thing? Let's pull back the curtain on this hidden inflammation and really understand what we're dealing with. Simply put, it's Crohn's disease, but without the warning signs. The inflammation, it's there, it's active, and it's doing its thing, just like in typical Crohn's. The only, and I mean crucial, difference is the lack of pain or major discomfort to let you know something is wrong. And you might be thinking, well, this must be super rare, right? Not exactly. Some research suggests that about 1 out of every 4 people with active Crohn's disease could have this silent version. That is a ton of people who might have no idea their disease is actually progressing. And that brings us right to the heart of the problem. The silence is the danger. Because when you feel fine, you don't go looking for treatment, right? And all the while, real damage is being done. So let's look at just how bad it can get. This quote from a major study at Mount Sinai, it's honestly pretty chilling. It found that even for patients who feel like they're in remission, if that hidden inflammation is still there, 2/3 of them will end up with progressive bowel damage over time. It's a stark reminder that feeling good isn't the same as being healthy. And the data just gets scarier. Patients with this kind of silent inflammation, the ones feeling fine but with high inflammatory markers, they have almost double the risk of ending up in the hospital compared to people whose inflammation is actually under control. And the long-term outlook is even more concerning. That same group with the silent inflammation was found to have nearly 7 times higher odds of their disease getting worse, leading to really serious compounding damage over the years. So when we say damage, what does that actually mean? Well, we're not talking about minor stuff. We're talking about things like strictures, where your intestine literally narrows and can get blocked, or fistulas, which are these abnormal tunnels that form between organs. And what this all leads to, far too often, is a much greater need for surgery down the road. So if you can't trust your own body's symptoms, how in the world do doctors find this disease? Well, they basically have to become detectives, hunting for these invisible clues to see what's really going on under the surface. It's really a multi-step investigation. They usually start with some simple biomarker tests, things like C-reactive protein in your blood or calprotectin in your stool. If those tests flag some inflammation, they move on to imaging. But the real gold standard, the final step, is an endoscopy, which lets them get a camera in there and see the lining of the bowel with their own eyes. But this all raises a really fascinating question. Why? Why don't some people feel the pain? Well, new research is pointing towards a possible genetic reason. One study found that some people who have a reduced sensitivity to pain actually carry a specific genetic mutation. It literally changes the wiring of their nervous system, affecting how they perceive pain from all that inflammation. So, okay, they've found the invisible inflammation. Now what? Well, this whole situation has forced a complete shift in how doctors manage Crohn's, kicking off a whole new era of treatment. This right here is a huge, huge change in thinking. The old way? It was simple. Make the patient feel better. Control the symptoms. But we know now that's not good enough. The new goal is what's called mucosal healing, which means making the inside of the bowel actually look healthy no matter how the patient says they feel. And this whole new philosophy is called treat to target. The idea is to use objective proof, like those lab tests and endoscopy results, as the actual target. Doctors then adjust and ramp up treatment until they hit that target of mucosal healing, even if the patient didn't have any symptoms to begin with. This chart does a great job of showing how treat to target works. It's all about getting ahead of the disease. So, instead of just asking about pain, doctors are setting an endoscopic target, like getting to a really low inflammation score within 6 to 9 months. They're watching those objective markers, aiming for a specific low number. And if those targets aren't hit, they change the treatment plan. It's a proactive strategy meant to stop the inflammation before it causes all that long-term damage. So, with this modern approach, the goals are so much bigger than just short-term relief. It's all about preventing those serious complications, getting to a true, deep, long-lasting remission, and at the end of the day, making sure someone has a much better quality of life for years and years to come. Look, if there is one single thing to take away from all of this, please let it be this. When you're talking about a chronic disease like Crohn's, how you feel or don't feel, it just doesn't tell the whole story. Feeling well is not the same as being well.